friends, welcome back to my channel. Today I am going to discuss the very important essay topic for the dental students, that is occlusion in complete denture. Coming to the introduction part, occlusion and its relationship to the function of stomatognatic system have been widely studied in dentistry since many decades. A balanced occlusion appears to be the most appropriate because of the tooth contacts observed during non-functional activities of the patients. And in this lecture, I will try to discuss various concepts regarding the occlusion in complete dentures. First, discuss what is the difference between natural and artificial dentition. So, before moving to the concepts of complete denture occlusion, we have to find out what are the differences between the natural and artificial teeth. The natural and artificial teeth. The natural teeth, here the periodontal ligament is there and it supports the teeth. Okay, but in artificial teeth there is no periodontal ligament. In the natural teeth, they function independently, and in the artificial teeth or complete denture, it functions as a group. Here the malocclusion is non-problematic over the years, whereas in complete dentures, the malocclusion causes drastic problems. Here non-vertical forces well tolerated, but in this situation, non-vertical forces are damaging to the supporting tissues. Incising doesn't affect the posterior teeth in natural dentition, whereas in the artificial teeth, incising affects all the teeth on the base. Here the second molar is favored position for mastication. Here the heavy pressures of mastication in second molar region tilts the base and shifts it on the inclined surface. So in the natural teeth, bilateral balance is rarely found, and if present, it is considered as an interference. But in the artificial teeth, bilateral balance is necessary for the base stability. Here the proprioceptive impulses give feedback to avoid the prematurities and interferences. So a habitual occlusion away from the centric is established. Here no feedback of proprioceptive impulses and the denture base rest in the centric relation. Any prematurities in this position will shift denture base. Okay. This is the Christensen's phenomenon. It is present in the natural dentition. If the artificial teeth are arranged similar to the natural teeth, then the denture may lose stability due to the lever action during protrusive movements. So here this is the lever action, and if the artificial teeth are arranged in a similar way to that of the natural teeth, then the denture may lose the stability during the protrusive movements. So here balance through the incorporation of anteroposterior compensating curve. So Christensen's phenomenon is not found in the artificial dentition. Okay. Coming to some terminologies. First one is occlusion. What is occlusion? It is a static relationship between incising or masticating surfaces of maxillary or mandibular teeth or tooth analogues. What is articulation? It is a contact relationship between occlusal surfaces of the teeth during the function. Centric occlusion is the occlusion of opposing teeth when the mandible is in centric relation. It may or may not coincide with the maximum intercuspation. What is maximum intercuspation? It is a complete intercuspation of opposing teeth independent of the condylar position. What is excursive movement? It is the movement occurring when the mandible moves away from maximum intercuspation. What is eccentric? Any position of mandible other than that which is in its normal position. And what is eccentric occlusion? Any occlusion other than the centric occlusion is known as eccentric occlusion. What is balancing side or non-working side? The side of the mandible which moves towards median line in lateral excursion, that is balancing side or non-working side. What are balancing interferences? These are the undesirable contacts of opposing occlusal surfaces on the non-working side. And what is balanced occlusion? It is the bilateral, simultaneous, anterior and posterior occlusal contacts of the teeth in centric and eccentric positions. This is the working side contacts, this is the balancing side, and this is the protrusive contacts. Okay. Coming to the definition of balanced occlusion. Balanced occlusion is defined as the simultaneous contacting of maxillary and mandibular teeth on the right and left and in the posterior and anterior occlusal areas in centric and eccentric positions. It is developed to lessen or limit tipping of the rotating of denture bases in relation to the supporting structures. So this is the balanced occlusion according to GPT. So it is defined as the simultaneous contacting of the maxillary and mandibular teeth on right and left and in the posterior and anterior occlusal areas in centric and eccentric positions. Okay. And it is developed to lessen or limit tipping of rotating of the denture bases in relation to the supporting structures. Let's discuss what are the characteristic requirements of the balanced occlusion. A balanced occlusion should have some characteristics. There, all the teeth of the working side, that is from central incisor to the second molar, should glide evenly against the opposing teeth. No single tooth should produce any interference or disocclusion of the other teeth. And there should be contacts in the balancing side, but they should not interfere with the smooth gliding movements of the working side. And there should be simultaneous contact during the protrusion. What is the importance of the balanced occlusion? So, let's discuss the importance of balanced occlusion. As we already know, balanced occlusion is one of the most important factors which affect the denture stability. So, one of the most important factors which affect the denture stability is the balanced occlusion. Absence of this occlusal balance will result in the leverage of the denture during mandibular movement. Okay. Shepard stated that enter bolus and exit balance. According to this statement, the balancing contact is absent when the food enters the oral cavity. Here it is the picture showing the bolus in and it is the balance out. That is enter bolus and exit balance. Okay, here there is a bolus and here the balance is out. That is enter bolus and exit balance. It implies that the introduction of food on one side will prevent the teeth of opposing side from contacting and hence occlusal balance is impossible during the mastication. This is the concept of enter bolus and exit balance. Prime gave the concept. Okay. Brewer and Hudson in 1963, they found in a 24-hour test that normal individual makes masticatory tooth contact only for 10 minutes in one day compared to 4 hours of total tooth contact during other functions. So for these 4 hours of tooth contact, the balanced occlusion is important to maintain the denture stability. And it improves the stability of the denture, reduce the resorption of the residual ridge and soreness, and improve oral comfort and well-being of the patient. Okay. What is the rationale of the balanced occlusion? It involves the arrangement of the teeth to provide even tooth contact between the posterior and anterior teeth as the mandible moves to and from centric and eccentric positions. So it involves the teeth arrangement, okay, to provide the even tooth contacts. And the purpose of this arrangement of teeth is to provide stabilizing forces to denture bases on their basal seat when the teeth make contact and jaw are in centric or eccentric relation. Coming to some theories of complete denture occlusion. First one is the Bonville's theory. It is in 1858. It is the theory of equilateral triangle. And here the teeth move in relation to each other as guided by the condylar controls and the incisal point. This is the condylar control and here it is the incisal point. So here the teeth move in relation to each other as guided by the condylar controls and the incisal point. Okay. This is the boneless theory. Next theory is the conical theory in 1915. Here the lower teeth move over the surface of the upper teeth as over the surface of a cone. Here it is a cone and the teeth move over the surfaces as over the surface of a cone. Okay, and with the central axis of cone tipped at 45-degree angulation to the occlusal plane. Here it is the 45-degree angle. This is the conical theory in 1915. Okay. Here it is the spherical theory in 1918. This is proposed by Gysi. It was based on some observations of the natural teeth and the skulls made by von Spee. So these are the theories of complete denture occlusion. What is a static concept? The static relations in the occlusion, which include centric occlusion, protrusive occlusion, right and left lateral occlusion. And these relations must be balanced with the simultaneous contacts of all the teeth on both sides of arch at their very first contact. And the cuspal inclines should be developed so that the teeth can glide from more centric occlusion to the eccentric positions without any interferences and without the introduction of rotating or tipping forces. Coming to the dynamic concept, here it is primarily concerned with the opening and closing movements which is involved in mastication, and the jaw movements and the tooth contacts are made as the teeth of one jaw glide over the teeth of the opposite jaw. And the movements of the mandible which occur when the teeth are not in contact are termed as free movements. And which are the concepts proposed to attain balanced occlusion? First one is the Gysi concept. Gysi, who proposed the first concept towards the balanced occlusion in 1914, and he suggested that arranging 33-degree anatomic teeth could be used under various movements of the articulator to enhance the stability of the denture. This is the picture showing the Gysi's concept in centric occlusion, and here it is the right lateral position. Okay. And in the centric occlusion, the masticatory force is directed toward the ridges. In this picture, it shows the forces directed toward the ridges. And in right lateral position, the occlusal contact forces are directed away from the ridges. In extreme working lateral position, contacts on the both cusp incline and contact forces are also directed outside the ridges. Okay, here it is the Gysi's concept in right lateral position. Coming to the French concept, according to this concept, the occlusal surface of the mandibular posterior teeth had been reduced to increase the stability of the dentures. And here the maxillary posterior teeth have slight lingual occlusal inclines of 5 degree for the first premolar, 10 degree for the second premolar, and 15 for the first and second molars. So the balanced occlusion could be developed laterally as well as anteroposteriorly by the arrangement of teeth on a curved occlusal plane. Okay, here the picture showing the French concept in centric occlusion, and here it is in right lateral position. So in this picture, half of the width of mandibular posterior teeth helps to direct the masticatory forces in a buccal direction to the mandibular residual ridge. Okay. And in right lateral position, the occlusal contact forces are directed toward the ridges on the working side and away from the ridges on the balancing side. Here the toward the ridges, and this is the away from the ridges in right lateral position. Okay. And here he used modified French teeth to obtain balanced occlusion. Coming to the Sears concept, this is the Sears concept in centric occlusion, and here it is in the right lateral position. So he proposed the balanced occlusion for non-anatomical teeth using posterior balancing ramps or occlusal plane which curves anteroposteriorly and laterally. Here it is the balancing ramp which is used with the monoplane teeth to achieve balance. Okay. In the centric occlusion, the non-anatomic teeth will exert contact forces toward the ridges. Here it is the Sears concept in centric occlusion, and this is the Sears concept in the right lateral position. Here the occlusal contact forces directed toward the ridge on the working side and toward the buccal side of the ridge on the balancing side. Okay. And coming to the Flusher concept, here it is the Flusher curve. Here it is in the centric occlusion and this is in the right lateral position. So the premolars and first molars are set in a reverse curve to prevent buccal tipping and seating the denture. This is the reverse curve. And the second molars are set in a conventional Monson's curve to provide the eccentric lateral balance. So here the premolars and first molar set in the reverse curve and second molar set in the Monson's curve. Okay. So this is a combination of curves, that is Monson and anti-Monson curves. This is not a single curve, and it was used for arranging non-anatomic teeth in the balanced occlusion. This is the Monson's curves and this is the reverse curve. Okay. This is the Flusher concept. Here this picture shows Flusher concept in the centric occlusion, and here it is in the right lateral position. So in centric occlusion, the contact forces are directed toward the ridges. Okay, here the forces are directed toward the ridges, and in right lateral working position, the occlusal forces are directed toward the lingual side of the lower ridge on the working side and toward the buccal side of the lower ridge on the balancing side, depending on the inclination of the second molar ramp. So here this is the Flusher's concept in right lateral position. Okay. Coming to the Fresh concept, here Fresh arranged teeth in one-dimensional contact relationship, which should be reshaped during trying to obtain balanced occlusion. And in 1967, Fresh gave the concept known as linear occlusal concept, which employed an arbitrary articulator balance followed by intraoral corrections to obtain balance. Okay, here the Fresh concept in centric occlusion, and here it is in the right lateral position. So in centric occlusion, the contact force is directed toward the ridges according to the linear occlusal concept. So this is the forces toward the ridges according to the linear occlusal concept. And here it is in the right lateral position, the contact forces toward the ridge on the working side and slightly toward the buccal side of the lower ridge on the balancing side at a given inclination of 6 degrees. Okay. In 1925, Rudolf L. Hanau, he presented a discussion paper entitled Articulation Defined, Analyzed and Formulated. And the articulation of the artificial teeth was related to 9 factors. So, mainly there are 9 factors in relation to the articulation of artificial teeth. They are horizontal condylar inclination, compensating curve, retrosive incisal guidance, plane of orientation, buccolingual inclination of tooth axis, sagittal condylar pathway, sagittal incisal guidance, tooth alignment and relative cusp height. So these are the 9 factors which is related to the articulation of artificial teeth. Hanau combined these original 9 factors and reduced them to 5 factors, that is Hanau's squint. So which are the factors? Condylar guidance, incisal guidance, cusp height inclinations, inclination of the occlusal plane, and the curvature of the occlusal surfaces. So these are the 5 factors of Hanau that contribute to the Hanau's squint. Okay, so which are the factors? Condylar guidance, incisal guidance, cusp height inclinations, inclination of the occlusal plane, and curvature of the occlusal surfaces. So these are very important factors which affect the balanced articulation. Okay. So this is Hanau's squint. What is that? This is the inclination of plane of orientation, inclination of condylar guidance, prominence of compensating curve, height of cusp, and incisal guidance. So these are the factors which contributes to the Hanau's squint. So that are the Hanau's factors or that contributes to Hanau's squint. Thielman, he subsequently simplified Hanau's factors in a formula for balanced articulation. So that formula is that K into I by OP into C into OK. What does this terms refers? K is condylar guidance, I is incisal guidance, C is cusp height inclinations, OP is the inclination of the occlusal plane, and OK is the curvature of the occlusal surfaces. So that is the Thielman's formula. What is that? K into I by OP into C into OK. Condylar guidance, incisal guidance, cusp height, inclinations, inclination of the occlusal plane, and compensating curves. And this is the Hanau's squint. I will try to discuss this in an easier way to memorize it. That is, in this picture, it shows plane of orientation, condylar guidance, compensating curves, incisal guidance, and cusp height. Okay. So according to this formula, K into I by OP into C into OK. That is condylar guidance into incisal guidance by cusp height inclinations into inclination of occlusal plane into curvature of the occlusal surfaces. So if the condylar guidance inclination increases, then the incisal guidance decreases and the other factors increases, that is cusp height, plane of orientation, and curves. So compensating curve increases. So if the condylar guidance increases, the incisal guidance decreases, and the cusp height increases, plane of orientation increases, and the compensating curve increases. If the compensating curve increases, then the condylar guidance and the incisal guidance increases, and the cusp height and the plane of orientation decreases. Okay. So this arrow mark which shows increases, and this arrow mark which shows decreases. When the height of cusp increases, then the plane of orientation and the curves decreases, and the condylar and incisal guidance increases. And inclination of the incisal guidance increases, then the condylar guidance decreases, and other factors, that is cusp height, compensating curves, and the plane of orientation increases. And the inclination of the plane of orientation increases, then the curves, then cusp height decreases, and the incisal and the condylar guidance increases. So this is about the Hanau's squint in combination with the Thielman's formula. Okay. Here the Hanau's squint which shows the relationship of 5 factors which determine the balanced occlusion. And here the harmonious occlusion where all the 5 factors of Hanau's squint balanced one another. Notice that the simultaneous contact of the incisors and the molars are in end-on relationship. Okay. And here when the condylar guidance is very steep, here the condylar guidance, it is very steep, then the posterior teeth lose the contact. and this can be rectified based on the Hanau's twint. Okay. Here it is the balance of 5 factors which is required for the balanced occlusion. That is incisal cadence, condylar cadence, cuspal angulation, angle of plane of occlusion, and the compensating curve. And this is the descriptive image of the relationship between incisal cadence, condylar cadence, cusp angulation, compensating curves, and the plane of occlusion. And balance of these 5 factors is required for the balanced occlusion. Okay. Next one is the Trapezius concept of occlusion. He reviewed and simplified Hanau's factors or Hanau's twint and proposed his triad of occlusion. According to him, only, as the name suggests, only 3 factors are necessary to produce the balanced occlusion. And he eliminated the important compensating curves and the plane of orientation. Other 3 factors are necessary for the balanced occlusion. Okay, which are the incisal cadence, cusp angulation, and condylar cadence. And he eliminated compensating curves and the plane of orientation. Okay. This is the Trapezius triad of occlusion. Okay. Here it is the increase in condylar cadence. Here the increase in condylar cadence, increase in the cusp angulation which progressively towards the condyle. And here decrease in the condylar cadence. So decrease in the cusp angulation which progressively towards the condyle. And here it is the increase in cusp angulation progressively towards the incisors. Here it is the steep incisor cadence. And this is the decrease in the cusp angulation progressively towards the incisors. Here it is the shallow incisal cadence. So this is the Trapezius triad of occlusion. Coming to the BOUCHE'S concept, he confronted Trapezius concept and proposed the following 3 factors for the balanced occlusion. Which are they? There are 3 fixed factors: orientation of occlusal plane, incisal cadence, and the condylar cadence. Angulation of the cusp is more important than the height of the cusp. According to BOUCHER, angulation of the cusp is more important than the cusp height. And the compensating curve which enables one to increase the effective height of the cusp without changing the form of the teeth. Okay. What is Lord's concept? Lord, he clarified Hanau's laws of occlusion by relating them to the posterior separation. That is the resultant of the guiding factors. So greater the angle of the condylar path, the greater is the posterior separation during the protrusion. Greater the angle of the overbite, the greater is the separation of the anterior and posterior regions, irrespective of the angle of the condylar path. And the greater the separation of the posterior teeth, the higher or greater must be the compensating curve. Okay. So this is the Lord's concept, the laws of occlusion, that is occlusion chart. It is based on some posterior separation that is resultant of these guiding factors. Okay. In this picture, it shows the simulation of condylar cadence in an articulator. Okay, this is the movement of a natural condyle and it is stimulated by the articulator. Here the posterior slope of the articular eminence, which is represented by the condylar track of the articulator. Okay. In this picture shows the shallow condylar cadence which causes the lesser posterior tooth separation on protrusion. Okay, here is the lesser posterior tooth separation which is on protrusion, and here the shallow condylar cadence. And this is the steep condylar cadence. Okay, this is shallow and this is steep condylar cadence which causes the greater tooth separation on protrusion. Okay. And here steep condylar cadence which requires the teeth with longer cusp and the deep fossa to achieve the balanced occlusion. Here the shallow condylar cadence which produces lesser tooth separation during the protrusion, and the steep condylar cadence which produce greater tooth separation during the protrusion. Okay. Coming to the incisal guidance. What is incisal guidance? It is the influence of the contacting surfaces of the mandibular and maxillary anterior teeth on the mandibular movements according to GPT. And this picture shows the vertical overlap. Here the vertical overlap, and this is the horizontal overlap, and this angle is the incisal guidance angle. Okay, it shows the incisal guidance angle. Here the vertical overlap, and this is the horizontal overlap. Okay, and this picture shows the steep vertical overlap which is required for aesthetics. Then a corresponding increase in the horizontal overlap will help to decrease the incisal guidance angle. So this is the vertical overlap, this is the horizontal overlap, and this is the incisal guidance angle. So here it is the shallow incisal guidance which will produce less posterior separation, and the steep incisal guidance which will produce more tooth separation. Okay, here it is the steep incisal guidance, and here the more tooth separation during protrusion. So greater the angle of the overbite, the greater is the separation of the anterior and posterior regions irrespective of the angle of the condylar path. Okay, so if the overbite increases, then the separation also increases irrespective of the angle of the condylar path. Okay. This picture shows the curve of speed. The compensating curves is the most important aspect in the balanced occlusion. Okay. This is the curve of speed, and this is the curve of Wilson, and this is the reverse curve. So here, the greater the separation of the posterior teeth, the greater or higher must be the compensating curve. So here it is the curve of speed, which is the most important compensating curve that can establish the balanced occlusion. So this is the curve of speed, and it can be increased to attain contact in the posteriors and hence establish balance. So this is the curve of speed. Okay. This is the posterior separation beyond the balancing ability of the compensating curve, which can be balanced by tilting the plane of orientation. Here the plane of occlusion can be altered to a maximum of 10 degree. This is the plane of orientation or plane of occlusion, which can be altered to a maximum of 10 degree. When the plane of occlusion is too high, then the leverage force acting on the denture also increases exponentially. Okay, if the when the plane of occlusion is too high, then the leverage force acting on the denture also increases exponentially. Okay, here 3x more lever forces. Okay, these are the cuspal angulations. Okay, these are the cuspal angulations, which is determined by the angle which is formed by the incline of the cusp with the horizontal. This is the incline of the cusp, and this is the horizontal. Okay, and the angle which is formed by the incline of the cusp with the horizontal is the cuspal angulation. Okay. Here the greater the separation of the teeth, the greater must be the height of the cusp of the posterior teeth. Here the cuspal angulation should be increased with the increase in the tooth separation during the protrusion. Here it is the protrusion. This is the no contact, and here the teeth contact after increasing the cuspal angulation. Okay. And this is the Lord concept. He simplified Hanau's squint using the chart as explained in the figure. Okay. Condylar path, incisal guidance, compensating curves, plane of orientation, and cusp height. This is the posterior separation or unbalanced occlusion. And here it is the chart which is known by Lord's occlusion chart. Okay. Coming to the Bernard-Levin's concept, it is quite similar to the Lord's concept, but he eliminated the plane of orientation. Okay, so here it is the 4 factors. So it is known as quad. Okay, which are the condylar guidance, incisal guidance, compensating curve, and cusp height. So he eliminated the plane of occlusion. As each controlling factor increased, tooth contact proportionally increased. So these are the 4 factors which is named as quad. The condylar guidance is fixed and is recorded from the patient. The balancing condylar guidance includes the working condyle Bennett movement, which may or may not affect the lateral balance. Incisor guidance is usually obtained from the patient's aesthetic and phonetic requirements. However, it can be modified for special requirements. For example, reduction of incisor guidance is considered to be helpful when the residual ridges are flat. Okay, so here the balancing incisor guidance. Then the compensating curve, it is the most important factor for obtaining balance. Monoplane or low-cusp teeth must employ the use of a compensating curve. Here it is a balancing compensating curve. And this is the cusp height. It have the inclines necessary for the balanced occlusion, but nearly always used with a compensating curve. Okay. Here the working and balancing cusp inclines. So this is the laws of protrusive and lateral balanced occlusion, which is developed by Bernard Levin. Okay. Quad is relatively easy to understand and use, and this concept of controlling posterior separation is an important goal for achieving bilaterally balanced denture occlusion. Okay. So this is the laws of protrusive and lateral balanced occlusion. Here the steepness of the curve of P. The angle which it forms to the occlusal plane, and others which suggest the measuring the distance between the line connecting the canine and the second molar and the deepest point in the mandibular occlusal plane. This is the mandibular occlusal plane. Here the mandibular occlusal plane, and this is the deepest point in the mandibular occlusal plane, and this is the depth. Okay, and other methods of measuring this curve include cephalometric measurement and determining the radius of curvature. Here the incorporating of the curve of P during artificial teeth arrangement will help to provide posterior tooth contact during protrusion. Ability to obtain 3-point contact during protrusion is called protrusive balance. Okay. Coming to this chart, which it shows the compensatory changes done to attain balanced occlusion. In case of steep and shallow incisal guidance. So here the steep condylar guidance with steep incisal guidance. So here the steep condylar guidance, reduce incisal guidance, the use of anatomical teeth, increase the plane of occlusion and setting teeth with the steep compensating curve. Here the shallow condylar guidance with shallow incisal guidance. So here the shallow condylar guidance, increase incisal guidance. Here non-anatomic teeth is used, reduce the plane of occlusion and set teeth with shallow compensating curve. Here the steep condylar guidance with steep incisal guidance, use anatomical teeth, increase the plane of occlusion and set teeth with the steep compensating curve. And here the shallow condylar guidance with the shallow incisal guidance. That is the use of non-anatomical teeth, reduce the plane of occlusion and set teeth with the shallow compensating curve. Okay. This is the balanced occlusion in centric occlusion. Here the balanced occlusion in right lateral position, and here the protrusive position. That's all for today's lecture. The part 2 will be continued in the next lecture. Thanks for watching. Please do like, share and subscribe my channel for more videos.